Hey everyone, I'm Hartford Healthcare's Tina Verona. Well, tomorrow is a big day for women. It's Go Red for Women from the American Heart Association. And here at Windham Hospital, there is a big event that's going to be happening tomorrow, the Heart Healthy Expo. It's going to be tomorrow from 5:30 to 9 p.m. And I'm so happy to be joined by Teresa LaFleur. She's a registered nurse here at Windham Hospital. Teresa, thanks for joining us.
Thank you. Thanks for having me.
Yeah, so a big event tomorrow, lots going on. Sort of give us a rundown of what people can expect.
Well, we open the doors at 5:30. You can buy a ticket at the door. We have a little itinerary here. We have some breakout sessions, a couple of cooking demos, an herbal tea blending, and learning how to establish or make a salad in a jar. Some educational things, some screenings. Dr. Paul Thompson, who's a director of cardiology at Hartford Hospital, will be speaking, and he's an awesome speaker, very dynamic. We have vendors, swag bags.
Yeah, this is one of the swag bags
right
here,
here.
right, with some of the items in it here as well. Talk to us a little bit about the health screenings. What are you going to specifically be doing?
Well, of course, we have some people taking blood pressures. We're going to be doing some bone density screening. We have the diabetes educators that are going to have sort of kind of a healthful eating. I think they're going to do something to building a grain bowl.
And there's some wine tasting too.
And there's wine tasting from a local vineyard, London Green Vineyards.
Yep, and there's also a raffle, and these are just two of the items,
Yep.
right? A Kate Spade bag and some hats and gloves, as well as some other handbags.
Yep, all the vendors will be providing and I think we have 11 vendors, and they'll be providing something for the raffles.
So I'm going to talk about, the message behind the message, the message of this event tomorrow, but really the message behind this event tomorrow, which is so critical and it's so important. Let's talk about heart disease in women. How prevalent is it nowadays? What are some of the trends that we're seeing?
So I think that the message behind the message is for women to know that it's real for us. It's the number one killer. Many times people think it's different cancers, and it's the number one killer of women. And it can be chronic. And the big thing is our symptoms are very different than what a man might feel.
Yeah, I want to hold this up here. So this is heart attack symptoms, men versus women. Some of them are the same, but you can see as we get down here, it differentiates.
Yep.
And you see chest pain, indigestion, extreme fatigue, could almost really be anything.
That's right.
How do you know when it's something serious?
I think women have to go with their gut and know it's something new, it's something they don't usually feel, to listen to their bodies. Doesn't mean you're hysterical, but especially if you have risks for heart disease, and the risk factors for heart disease, that's another thing we'll touch on at the event in our screening room. So the risk factors of high cholesterol, high blood pressure, diabetes, if you're inactive, all those things help to support that. It could be your heart giving you those symptoms.
And it's really important for women to know their numbers. How often do you see that women don't know their numbers, like they don't know their cholesterol or their blood pressure or check it routinely?
I think nowadays more people are in tune to it. Sometimes people still don't ask their doctor, but I think with the avenue of, like, for instance, Hartford Healthcare has MyChart Plus, you can go on, you can get those numbers, and you can compare. So I think people are consumers and are taking care of themselves better in general, and they're so participating in their care by looking those things up and knowing their numbers. I think it's better than it used to be.
Absolutely. And what are we seeing in terms of women versus men? Are we seeing more women versus men? Is it still more men? Is it still?
I think that it's just important to know that it can be both, and to not discount your symptoms, because you've got to advocate for yourself. You know that something's not right.
And with this event tomorrow, so you're in cardiac rehab here at Windham Hospital, and so it's a almost sort of a reunion of sorts, because you were saying how you do see some of your patients that have gone through cardiac rehab, which you don't typically see afterwards, or you hope not
Or
anyway,
you
right?
see them in Stop and Shop or
you
something
see them in
like
Stop and Shop, right? But you don't see them here, which is a
No.
good thing. But they do come back to this event.
They do. So we you know, we advertise in our program, and so over the years, because we've been doing it now for probably about 15 years, this is the 15th year we've done something very similar, and we get 150 people typically at our event, and so we have repeaters, and many times it's our cardiac rehab patients, which is great because it's great to see them.
Yeah, and tell me a little bit about the cardiac rehab program here at Windham Hospital. So a patient either comes in, they have a heart attack, they have surgery, whatever it is,
Yeah.
but then their last final step, which is such a critical, important step, is to not miss cardiac rehab. Oftentimes you think people, well, I'm all done, I've had surgery, whatever, I'm going to go home.
I'm walking around the
and I'm walking
block.
around, I feel great, I don't need cardiac rehab. But this is a critically important step. Talk to us about why people should not miss cardiac rehab.
So cardiac rehab at the hospitals that have it, it's a 36 sessions, so it's 3 months long. It's 3 times a week. And it's exercise, but it also gets the person in, and they are learning about their risk factors, and we're helping them, whether it's quit smoking, we're coaching them to, exercise. It's fun. I think mentally it is so great for people to get out of the house and come and do all this and feel like they're back, on the bus again.
It's almost like having a personal trainer of sorts, because you guys are sort of there with them every step of the way. You're helping them with exercise, with diet, with really getting them back to a healthy lifestyle.
So we most programs have nurses and exercise physiologists. So in that way, somebody is prescribing their exercise and monitoring things, things that we need to look for.
What's your message to women on this eve of Go Red for Women Day?
Know your numbers and know your risks, and listen to your body and advocate for yourself. I think that's the big thing.
Such an important message. Teresa LaFleur, thank you so much for joining us. And I think the other message here is to stop by tomorrow. This is the actual ticket. So the event is Go Red for Women, the Heart Healthy Expo here at Windham Hospital, Friday, February 7th. Tickets starts from 5:30 to 9. It is $20, and the guest speaker, as Teresa mentioned, is Dr. Paul Thompson, a cardiologist who's really a wonderful, very eloquent speaker. So we hope to see you out here tomorrow here at Windham Hospital. Hartford Healthcare's Tina Verona. Thanks for watching, and we'll see you soon.